Welcome to another episode of Marketing Tips for Doctors. I'm your host, Dr. Barbara Hales, and today we are going to be trying something a little different than what we've done before. On previous episodes, it's always been about marketing for doctors, hence the name. But we have expanded so that once a month, we are also going to be doing a physician showcase to highlight extraordinary doctors in their fields. So I'm happy to say that today we have with us Dr. Kylie Burton. She's an expert in functional medicine and helps thousands of individuals with seemingly impossible health struggles find answers, healing, and hope, even if they've been told that their labs are normal. Besides helping patients, she teaches practitioners of all backgrounds how they can level up their patient results using her techniques. Once on stage, now it's a weekly live series on Facebook because, as you know, there really are no live events during this pandemic time. As a guest on dozens of podcasts, she also hosts the podcast Beyond the Diagnosis with Dr. Kylie and has been featured on the Sheila Mack Show on KCAA Radio this past month. On TV, she has been a guest on Good Morning Utah and Fox 26 Houston. Welcome to the show, Kylie.
Thanks for having me, Barbara. I'm excited to talk to fellow practitioners and doctors of all backgrounds.
Well, it's very exciting when talking to you to hear that you have just gotten off a show where you have been teaching 1,000 practitioners. What is it that you spoke about?
So today was all about the thyroid panel. I'm an expert in reading labs. I love labs because numbers never lie. But I take those normal lab ranges and I condense them into a smaller lab range that we often call the functional lab range. And I teach based off of that, how do you read those labs? And then once you know what the numbers say, turning it into a treatment plan. So today was all about the thyroid, the HPT axis, and then working from a thyroid lab standpoint. How do we create a treatment plan that works and is individualized for every person based off of their labs?
How is it that you interpret the labs differently than the average physician?
The way I look at labs, and the reason why I have to look at them this way, is when I was in medical school, I was sitting in, as a student, I had all these people coming in from the community to get help as I was becoming this functional medicine type person. And I wasn't just dabbling my feet into it. I dove straight head first into it. And this lady came in, she had every MRI, CT scan, blood work, everything in the books was normal. Yet here she sat on the table. We had to find a blanket, a black blanket to cover the window because it was just too much light, even with the window closed. Her migraines and she was just so sensitive to any light. And she'd been like that for years. So I said to myself, if I look at her and everybody else the same way that everybody else does, I'm going to get the same results. And that's not okay with me. So I've trained myself, and it was all training outside of school to take the normal lab ranges and condense them into the smaller lab ranges. And then I can say, based off of this normal blood work, this CBC, I can determine, is there an infection causing XYZ? If there is an infection, what type of infection is it? And based off of bacterial, viral, fungal, parasitic, those type of infections, I now know what it is that's preventing so-and-so from really healing, no matter what type of medicine they've tried.
Could you explain to the audience what functional medicine is, especially since you went to regular medical school? So how has your path diverged? And what could you explain what functional medicine is for the listener out there?
Yeah. Functional medicine to me is personalized medicine. It's discovering the why behind everything. So if a patient comes into the office and they say, I have this headache for 9 days straight. I've tried everything to get rid of it, including sleep and ibuprofen. It just isn't going away. Instead of saying, okay, let's try this other medication, I'm going to say, well, what's causing the migraine? Let's look into a little bit different, deeper. And I'll give you an example here of a lady I just had a couple months ago. She went into a chiropractor, a massage therapist, her primary care doc, because all of a sudden she woke up that morning with a frozen shoulder. Her right shoulder just literally, she couldn't move it. She just woke up this way. And then as the days go on, pain starts creeping into all of her other joints. But everybody, manual therapy, chiropractor, primary, I mean, she's getting cortisone injections in her shoulder. They're all focusing on the shoulder. 3 months go by and she still can't move it. She's 31 years old, has a 4-year-old and a 1-year-old. So she's practically my age. She's sitting in my shoes with my kids too. But I can move my shoulder. She can't. So she has this problem that everybody's just focusing on right here in her shoulder. And I said, well, if you've tried all the manual therapy, you've tried everything, you've tried the cortisone injections, you've tried it all specifically for the shoulder. Let's just see. So what I do in my office is I'm virtual. I'm completely virtual, and I've been this way for the last almost 2 years now. So I was virtual before it was cool to be virtual.
That was lucky.
Yeah, I count my blessings with it. But so I said, let's pull your medical records. That's what I do with practically everybody, because we all have this blood work. We've already donated the money for it. The patients have already spent the time and given the blood up for it. Let's just grab it. They have the tests. If I can spin the way I look at them and say, you might be normal, but you're not ideal, now I can figure out underlying causes. And I was able to do that with her shoulder and the rest of her joints. So when I see people with chaotic hormones, chaotic symptoms, just they don't fit underneath an umbrella of a diagnosis, you got to think systemic. And you got to figure out what's going on inside the body that's just causing chaos, no matter what that chaos is. And for her, the chaos was the shoulder pain. So I pull her lab tests and I pull her medical records, and I see this number, white blood cell count, WBC, the very top marker on the regular CBC, right? I'm talking to doctors, right? So the CBC count, the white blood cell count, should be ideally between 5 and 8. That's your ideal functional range. So if it's less than 5 or greater than 8, I know I'm dealing with an infection. And for her number was 17.9, I believe.
Wow.
So I was like, whoa.
And nobody
That's one of the highest I've ever seen.
Yeah, and nobody tried to explain that? Nobody did cultures?
No. So I asked her, I said, well, what did your doctor do when he handed you these labs? And she's like, well, he said that my number was high, but that had nothing to do with my shoulder. So he just, moved on and kept going.
That's kind of shocking.
Yeah. And I looked up the clinic online, of course, and the clinic does not have good reviews. So it's probably not the only scenario here. So I said, well, your body's fighting an infection. I don't know what type of infection it is until we look farther down. And when I looked farther down and I got into her neutrophils, and for me, I'm giving you a CBC report here. For me, a neutrophil needs to be around 60%, if not lower. And when I see a number that's above 60%, I think, okay, neutrophils fight bacteria. So if they fight bacteria and they're high, I know I'm dealing with a bacterial infection. But it's probably not high enough to go get a positive test on an H. pylori, C. diff, E. coli, Campylobacter, any of those those bacterial infections that we think of. And thank goodness it's not, because that's like full-fledged diarrhea for days. But it's a low-grade, hidden bacterial infection that the body's still fighting.
Do you screen for Lyme disease or cultures like that, which are not typically screened for by the average doctor?
I don't, just simply because I pull medical records, and whatever they have in their medical records, I work with. And if we need to go get further testing, then of course I'll send out and get further testing. But like I've found Lyme that I'm pretty sure is Lyme multiple times, especially in Parkinson's patients, but I don't have an actual Lyme test. I say, okay, based off of your symptoms and based off of the pattern that I'm seeing here in your numbers, I would be safe to say that it's Lyme and we're going to treat it this way. And it's worked every time. So based off the neutrophils, she had the bacterial infection because her number was 88. 88%, which is one of the highest I've ever seen. Usually it's like 68, 70, maybe 72. Hers was up there at 88. So 3 months have gone by. We've tackled the bacterial infection. I use supplements. I use systemic formula supplements, and we tackled that infection. Her shoulder's just fine, and her joint pain's gone.
So you don't give them antibiotics. You try to treat it with diet and supplements.
Yeah. Yeah, and I'm not a fan of antibiotics unless, they're absolutely needed. But what I found is when you use the right supplements, um, for me, it's systemic formulas, is that I can do the work that needs to be done, the healing that needs to take place, and then I can move on. And they don't have to take supplements for the rest of their life either. I'm not a fan of that either. So for me, I go in, get the job done. So for her, we cleared out the bacterial infection, we healed the leaky gut, we rebooted, replenished the gut with everything good that it needs. Now she's ready to rock and roll.
Well, I'm sure there are a tremendous number of people that you helped and can help with that approach, which seemingly fall through the cracks.
Yeah, there's a lot of them. When I first got out into the world of functional medicine and this alternative world thing, I thought, I was gonna have to do a bunch of elimination diets with people. They're already doing it. These people are so desperate for help and just feel better in any way, shape, or form. They're eating 7, 8, 9 foods a day, every day, all day long, the same foods. And my goal with them is like, okay, you took out the triggers, you took out some of the triggers, but this isn't a way to live life. You don't want to just eat these foods forever just to survive. You want to thrive and you want to live and enjoy life. And part of enjoying life to me is food. So we take the gut. My 3-step gut approach is, what do I have to destroy? I can usually figure that out with the CBC and the infection. The next step is to heal the leaky gut. And then the third step is, once we've destroyed all the bad guys, we got to get the good guys replenished back in there. And that would be my 3-step approach to any gut stuff. And it takes it to a whole nother level than just food sensitivity testing and eliminate foods.
Do you have your own supplements, or is there a particular brand that you recommend?
The supplements I use, it's a company called Systemic Formulas, and that's the bulk of them that I use. They are actually like 10 miles from my house in Utah, and I grew up here. I had no idea that these guys even existed until my mentor was like, you're using the wrong stuff." So he introduced me to them, and that's actually how I teach the practitioners as I'm inside the Systemic Formulas group on Facebook, and then I go into that group that there's about 1,000 of there's like 988 of us now, that I just teach, how do I read the CBC? How do I read? Today was thyroid panel. Next week I'm gonna do examples of thyroid labs and the breakdown of that, and then we'll continue on into iron panels and lipid panels and the organic acid tests. And I love labs. I love labs and numbers. They don't scare me at all. In fact, I can, and the most complicated patient, I just say, okay, give me your labs. Let me see what they say. And then we can use those labs and map out a plan. And I'm pretty confident and works over 90% of the time. So
I think you're the first professional that has voiced this and your proclivity towards labs. It's not something that the average person, states.
yeah. And there are functional medicine lab tests out there. There's things like organic acid tests and microbiome tests and GI maps and hormone panels. I mean, you can spend thousands and thousands of dollars in functional medicine labs. And that's great if your clients and patients can handle that kind of financial strain. But for me, I'm just like, how do I find it? How do I find a way? Speaking of marketing for doctors here, how do I find a way to make this so I can help more people? I can be a mom, and my outreach is expandable. Like I'm not limited to a certain location. In fact, I shipped supplements to France last month. Um, so I tried to say, okay, one, I want to be able to help more people, which means I got to watch my time and I got to watch the finances. I've got to figure out, how do I do this in a way that more people can afford it, but it's not strenuous on my time. So a couple months ago in January, I launched my membership site. My membership site's $99 a month, and I no longer work with patients one-on-one. if so I'm about to 50 right now, and I could never ever in my life dream of working with 50 people at the same time. I only work 20 hours a week, and as my little kids are off at the babysitters for 3 days a week. So I had to figure out time, finances, and even with my 10-month-old baby, I worked. I took 1 week off the week I had her, and then I was back in the office working. But I was only able to do that with her sitting in my lap because I am virtual. And the Zoom calls and all this fun stuff was just natural to me when COVID hit. But I found that with the membership site, it takes the stress off of me. And 99 bucks a month, like you can't find that anywhere else. But I can help so many more people. I read their labs, I teach them how to read labs. There's all my courses and programs inside it so they have content to do. We go live once a week. They have I just incorporated, instead of a Facebook group, I was like, how do I make this more personal? I don't want people to come into the Facebook group when there's 10 people in it. And then, and however long it takes for there to be 1,000 people in it. I don't want the feeling to change. I want people to know how many people are inside this group, how many people I'm helping at the same time. Right. So I went to a texting service. So now I have this phone number there where they can text, and it's not my cell phone, it's just an app. So I can keep it, I only get on it Mondays and Wednesdays, and so it stays that way. But that way when I go live, I can send a text straight out to their phone, or if they have any specific question, they can just text me in. So it's really, really nice, and I love it.
That's wonderful. How did you find your mentor?
I found my mentor, literally God put him in my path because I was at a random restaurant and he was at a random restaurant. We just happened to be at the same place at the same time. And the funny thing is, I was in the car feeding my baby before we went into the restaurant. And my mom, who my parents never spark any conversation with strangers. So the fact that she sparked a conversation with this stranger is very unusual to begin with. And anyways, they learned that he does functional medicine and is applied kinesiology trained professional. I had just opened my practice like 3 months ago. So I'm brand new into this. I know nothing about business compared to what I know now. I know nothing about treating patients compared to what I know now. And so they start talking to each other. My dad comes out and gets me from the car. I've got tears running down my face because I just found out my brother was having a baby, and I had just lost my baby girl at 20 weeks into pregnancy. So I'm trying to clean myself up as I go meet this person. And his name was Dr. Greg Mojon. I need to introduce you to him. He he's phenomenal on every aspect from business and treating patients. He's one of those guys that can start a clinic from the ground up and turn it into a multi-million-dollar clinic and sell it 3 years later, and then he just does the next thing with the next like the next location wherever he wants to be. So I started having this conversation with him, and I'm learning that you are exactly what I want. You want your mentor to be someone that you want, not otherwise.
Of
So he's
course.
like retired at
And
45.
somebody that does it himself.
Yeah, someone that's been through the realm. Um, so I just said, I'm brand new to this. I'm literally right out of school. I started my practice right out of school. Luckily I have my husband who pays our bills. And then everything I have just dumps right back into the practice to build it bigger. But at the time, this was 3 years ago now, almost, yeah, 3 years ago now this month. He he helped me along the way. And I remember there was one time where a patient walked out with $200 in supplements that I had included in her treatment plan. So it was all, included. And I texted him and I said, I'm not going to make it in this. This is what just happened. So he was at the time living an hour and a half away from me. So I drove down, met up with him again. He mapped out a business model for me because I really didn't have one. And we went from, I had like a month to month fee, which in my personal opinion is a lot better than a pay per visit fee. I wanted people to feel comfortable reaching out to me because I wanted them to be successful. I didn't want them to say, I can't go talk to her because it's going to cost me money. I don't have money for that. So I figured out, okay, it's just this monthly fee, come in when you need to. So he manipulated it some. Um, and I had one of the biggest things I had to overcome that I didn't know was a problem was my money issue. I had a big money issue. And it's not like growing up, I never, like, I always had what I needed. But for me to ask somebody for money for what was in my head was a very difficult thing.
Mhm.
Now I just spat it out. But he just said, okay, when you're going to close, you say XYZ, and then you say, literally say, does one better work better for you than another? You leave it. So he just made the closing part so much easier. And since then, 6 months went by, and I finally said, look, I need some real help here. Like, how do we take this, instead of me just texting you and feeling like I'm stealing your knowledge? Like, how do I become you become my mentor? So then we started working with each other much more closely, and where I would go on a phone call with him every week. He would map out some business things for me, map out some marketing things for me. But ultimately, he taught me how to become a better doctor. And he's a very big fan of labs too. So a couple months ago, probably like 6 months ago, he actually texted me a question about labs. And that's when I knew. I was like, okay, like
You've made it.
I know my crap. I'm up there now. If he's asking me about help for labs, I know that we're on the same level playing field. But like, an absolute genius in every way, shape, and form, business and marketing and patient care. So wherever you are, whether you're, a month in or a year in, or you're 650 and you're just starting your practice, like I've seen a lot of people reach out to me with this group that I teach in. And the biggest thing, that they're all shocked when I say I've been doing this for 3 years, and I'm teaching people who've been doing it for 20 years. There's one big difference, and the one difference is confidence. If you have confidence in what you're doing, it doesn't matter how long you've been doing it, your outreach and the successful rate you're going to have is going to be exponential. But I had to conquer two things. I had to conquer the lack of confidence that I had. And the way I've created it was, I became so good at reading labs and being able to decipher what's underneath those normal labs. So now I don't care what kind of patient reaches out to me and what their health story is, and if their marriage is falling apart. To me, it's just, what do the numbers say? Let me get the numbers. I'll map out the plan. And when I go down, people think this is absolute crazy, because I get a lot of people who have been down other roads, whatever road that is. They've spent, $200,000 on their care, and they're still not getting anywhere. They're When I can map out from day one, the very first visit, exactly what supplements they're going to take when throughout the entire 12 months, their trust level is exponentially greater. And I just map that out based off of the labs that they have and how they feel. So I have a really detailed questionnaire, and then I combine it with the labs. And I literally, in my report of findings, I say, okay, we go through the labs, I put all the puzzle pieces together, and then I say, does that sound like a plan to you? Yes. Okay, now let me show you what it looks like in detail. And then I literally have a supplement calendar that maps out every month what they're going to take, how much and when. They know the exact financial cost it's going to be, so that they know everything up front. And then I say, okay, you can do this by yourself because it's that detailed for you. But I'm going to tell you that there's going to be some bumps in the roads. And when those bumps come up, you're going to want to be able to reach out to me. So then if you go inside my $99 a month membership, you can reach out to me. Plus, there's a whole lot of other good stuff in there too. But that just totally relieves, one, the financial burden from their shoulders, and two, the trust that they have in you is by far greater than anything that they've ever experienced. And my closing rate's over 90%.
Well, that's very impressive. Now, when you first started out and you were confident that you could help people,
I
how,
wasn't confident I could help people when I first started out. Let's be
well,
real here.
well, when you started your practice, how did patients find you? Was it, word of mouth, or, like, how did they know to call you, or how to call you?
Yeah, so my marketing budget is practically next to none. When I first started out, I mean, my husband and I used whatever we had. He sold his house when we got married. And so we had a little bit of leftover. We had like $10,000 left over from the selling of his house. And that's what we used as a startup. And so what I found was I said to myself, okay, social medias exist, but there's no way I have time and energy to be everywhere. So I'm going to determine where's my avatar the most, and I'm just going to stick with that one platform. And that one platform for me was Facebook.
Mhm.
And personally, I've never been on Instagram. I've never been on Pinterest. I've never been on any of those other platforms. I've only done Facebook. And so when it comes to social media and marketing using those strategies, you have to think now that I've gone through enough training, I've spent over $100,000 at this point on other people training me to get to where I am today. But Facebook and social media in general, whether it's LinkedIn or whatever it is for you, one, you have to enjoy it. If you don't enjoy it, you're not going to post. And then two, of course, you want your avatar to be there listening. So my entire strategy from day one was I'm going to focus on Facebook and I'm going to have all my clients coming from Facebook. So I did. And I've built my entire practice on Facebook. I go live once. There's been times where I go live 3 times a week. I go live once a week, but I found that going live works around the algorithm, and you reach more people. And then I've also found that when I was working with people one on one, I would get phone calls, and they would say, "Well, I've been listening to your Facebook page for 6 months, and now I'm ready to go in." I had no idea they were there. They never commented, they never liked, they never did anything. They just slowly paid attention. And when they paid attention long enough and the trust was built, then they made the phone call. So I built my entire practice off of Facebook. I would throw a couple $100 into ads here and there. And in the beginning, I didn't understand how detailed and specific you had to have ad copy and a funnel landing page and the whole process in order to get emails or a low ticket sale, whatever it is that you're driving traffic towards. So for me, it was just I'm just going to create a Dr. Kylie Burton Facebook page and I'm going to run with it and see what happens. And then I've built my entire thing off of that. And then the second component is, especially if you have no marketing budget or a low marketing budget, are podcasts.
Mhm.
I've been on probably 50 podcasts now, multiple radio shows, whether it's in Europe or the US. But I made a goal back in December after I had all of my infrastructure built. I had my membership program built. I've got other programs built. So I was ready for this massive influx of patients and clients. So I made a goal. I'm going to be on 16 podcasts a month, which is 4 a week.
Have you succeeded?
I've succeeded and I've gone way farther to the point where next month I'm taking a break because I need to chill and take a break. But 30 minutes on a podcast or 45 talking about functional medicine and the approach, whether it's thyroid or autoimmune disease or nobody knows what to do with me or chronic fatigue and you keep getting told that you're a mom, like whatever it is, 30 minutes is an ideal time to really teach and educate and gain that trust.
Well,
And
especially
then
since getting your name out, people are saying, she's just what I'm looking for because she's got the answer that nobody else does for me.
uh-huh. Yeah. And I love it when I hear people say, "Well, I listen to your podcast and if I swear you're talking straight to me." That means I'm doing things right. I don't like when you're on podcast or whatever it is that you're doing, you want to literally focus about speaking to one person.
Mm-hmm.
You're not speaking to the masses, you're speaking to one person, but it will reach the masses because that's how detailed and emotional you get and or how specific the talk is.
How often do you post per week on your Facebook page?
So on my Facebook page, I go live once a week, but I only work Monday, Tuesdays, and Wednesdays. Those are my set days. Yeah, there are times where I work, from 9 to midnight on Thursdays and Fridays because that's when my kids are asleep. Um, but so one time a week live, and then I schedule every single night between 7 and 8 p.m. I have something go out scheduled. So it's really daily. but not any more than once a day, maybe twice a day if I had a podcast episode drop out that day.
Do you
And then
use Hootsuite or another automatic posting site?
I don't, I just use Facebook. I just go into their creator studio is what it's called now and schedule posts out.
Mm-hmm.
Yeah, because I'm only on Facebook. I don't have time. I don't have energy, and quite frankly, I don't even know how to run Pinterest or Instagram. I've never even
Mm-hmm.
been on there. So I just say
Okay.
I'm going to stick with Facebook. I'm going to make clientele off of that, and then so last July I started a podcast. I really wish I started the podcast way sooner, but I let technology scare me. So I run a podcast called Beyond the Diagnosis with me, Dr. Kylie, and I started it in July. I love it. I love being able to connect with other people like yourself, be able to um, not only connect with hosts, but also when you're on other people's podcasts, you're literally leveraging their network.
Mm-hmm.
And it's a big marketing strategy that I've used and taken a role in and played with across the world. And then I was on one last week and she's like, we need to turn this into a 3-episode series for my radio show. And my radio show reaches 30,000 people every single day. And each one of your episodes plays for 6 days straight. What? That's a big reach to me.
Yeah.
So I got in, we did the 3 episodes. We've already mapped out 2 more. So the way you gain these trusts with the hosts, and then the hosts now refer friends to you. I've had that happen too. And even I've got a host in Europe where I was on her radio talk show a couple months ago, and I just joined her again yesterday. The time I joined her yesterday, she introduced me as her doctor. I was on a podcast call with her for 30 minutes back in January. And then she's ordering supplements and got stuff going for her health. Already seen a huge benefit in the first month. So I get back on with her and she's like, hey, everyone, I had my doctor on call with me today and we're going to talk about autoimmune diseases. So not only do you get the connections with the host, then the host starts referring their friends as well as themselves. And then your podcast episode goes live. And what I do is I just channel everybody to my podcast. And I say, you know what? Go learn more. If you're already listening to podcasts, chances are you're going to be listening to more podcasts. And I'm not saying, okay, if you're on Facebook, which I have done, I've been running Facebook ads to my podcast as well. But I would say from my marketing standpoint, the podcast now for me has overtaken Facebook where I have more clients come in. And on my podcast, I say, hey, we got this membership site. We got this membership option. If you're ready to start healing beyond the diagnosis, come join us. $99 a month. I wake up Monday morning. I had 4 people join over the weekend. I
That's
didn't do
excellent.
anything
Yeah,
else.
that's
Right?
excellent. Yeah.
Yes.
So, in order for people to find this membership site to sign up, where do they go?
It's on my website. So drkylieburton.com/healing beyond the diagnosis . So it's called Healing Beyond the Diagnosis, the HBD Tribe. And you can even just find it on my website, drkylieburton.com. So there's that membership. I'm actually starting a mastermind group for practitioners in September. So you'll be able to start with that in August. So when you're ready for it, come join the podcast and you'll know when it's ready to go. But I'm literally going to teach practitioners, coaches, doctors of all backgrounds, how do you take things virtual, minimize stress levels, and expand your reach. And when you expand your reach, you expand your income.
Absolutely. Well, it has been an absolute pleasure speaking with you today, Kylie.
Thank you, Barbara.
Do you have any last one tip for your listeners out there?
My one tip would be to gain more confidence. And the only way you're going to gain more confidence is by doing it. Whatever it is for you, whether it's going live on Facebook or taking that first brave step and joining somebody on their podcast and being a guest on their podcast. Guys, there's 1,000,000 podcasts on iTunes right now, 1,000,000. Whereas 2008, there were only 1,000. So leverage other people's networks and just take that one step. I know when I'm teaching these practitioners and I get all these messages and everybody's just, they're just scared and they're hesitant. Don't be.
Yeah, a lot
And
of
we all
people
have to
are,
stop somewhere.
yeah, a lot of
Where,
people are afraid of technology.
yeah. And they're afraid of getting in front of the camera, whether it's, their computer camera and saying and fumbling over words. You're going to fumble over words. I fumbled over words right here, but it's real and people love real. And the only way to get better at it is practice.
Yeah, that's true. Well, thank you everybody for listening. This has been a great episode of marketing tips for doctors and our first ever showcase for physicians with Dr. Kylie. Thank you so much again for being here. And till next time.